I'm Erin Lawler, Chief of System Policy for the Texas Council of Community Centers. As you heard from my colleague, the Texas Council represents the local IDD and local mental health authorities across all 254 Texas counties. We appreciate HHSC's acknowledgement of inadequate rates for autism, which you heard from the gentleman on a few panels ago, and peer support services, inpatient bed day rates, and community nursing and attendant services, and community attendant services. We also support the placeholder request to reduce Medicaid interest lists. And this was the policy item you were asking about, Mr. Schroeder. So we wholeheartedly support interest list reduction, but we also know that IDD waiver interest lists cannot be reduced unless that effort is accompanied by stabilizing rate increases. Together with many other stakeholders, we urge attention to direct support professionals, or DSPs, and their wage rates in IDD community services. Texas Council wholeheartedly supported the 88th Legislature's investment in state-supported living center DSPs, increasing entry-level wages to more than $17 an hour, and that was an investment that Commissioner Young highlighted in her opening remarks today. According to state reports, this investment decreased vacancy rates by over 14% and turnover rates by approximately 20%. Unfortunately, community DSPs serving this same population did not fare as well. And the $10.60 an hour wages appropriated for community staff is not enough to address the current workforce crisis. We urge the 89th Legislature to support community DSP wages commensurate with wages for DSPs in state-supported living centers. Missing from the consolidated rate request is IDD Targeted Case Management, or TCM, a Medicaid state plan service which has not had a rate adjustment for more than 15 years, and for which the local authorities face unsustainable financial losses. Cost reports reflect system-wide losses of over $40 million per year for the past 4 years. Relating to another priority for people with intellectual disabilities, you may be aware our current system is not well designed to address the distinct mental health needs of this population. We appreciate HHSC's exceptional item request to expand statewide a promising specialized outpatient mental health program initially funded at 5 local IDD authorities by the 86th Legislature. We urge decision makers to support this request and include both children and adults in this IDD program. We also support the exceptional item relating to early childhood intervention. The request reflects an additional $18 million for per-child funding at current levels, given anticipated population growth. Fully funding this exceptional item is necessary to ensure very young children and their families have the supports they need to thrive in the community. I close by saying we appreciate the agency's effort to address a broad range of needs in their LAR and look forward to working with you throughout the decision-making process. Thank you.
Good afternoon. My name is Carol Rabelais. I am the Assistant Director of Homes and Community-Based Services with the Mary Lee Foundation. We are a waiver provided contract here in Austin, and we provide services to ICF, HCS, and CDS, as well as several other areas of the waiver services. When we talk about the amounts of people on the wait list and those that are receiving services now, just addressing the interest list is like saying how many cars can we put on the road without looking at the integrity of the bridge. If the bridge is collapsing and we put more roads on it or put more cars on it, then it won't help anyone. The current issues that have been plaguing the entirety of the community-based program have started a very long time. We've been coming to sessions after sessions talking about raising it to $15, and that was pre-COVID. And the market today is completely different. $10.60 is less than any fast food chain that you see. And this is very complicated work, working with behavior plans, being delegated by a nurse to pass medications that are critical to clients' needs daily, and as well as the additional support services that at a state supported living center would be covered by a whole different department. We have a housekeeping department or a medical department that does not fall on the duties of the direct care people. So our staff are asked to do all of these additional things that require training, that require supervision, without having the same rate that the state supported living center is offering. We have lost staff that have gone to the state supported living center. And I'm glad that they have had those increases of not having as much turnover, but that has made ours just so much more. And if you look at the percentage of people with IDD and developmental disabilities within the waiver programs, the largest percentage is in the community, and we have been more cost effective at providing these services. However, that means that we're looked at a little bit less because we're doing as much as we can with just the pennies. And at this point, it's a flat bottom rate. So we cannot find people to take the rates for dietary services, behavioral support services, PT, OT, all of the things that we are required to provide with our contract if the client needs it. And this has caused issues with setbacks for their development and their health. So as part of the number 24 item, we encourage that there be, because there is no line item specifically to IDD services, but we encourage that you look at changing that rate to match the direct care services, the wage rate at the same at the state supported living center. Thank you so much.
Good afternoon. My name is Melinda Mills. I also work at Mary Lee Foundation. I am a billing specialist, but I've also worked as direct care in the past. I would like to talk about the matter, which is dire need for funding in order to hire and maintain our direct care professionals. They are very, to me, I consider them, our clients, as the jewels, and the direct care staff as the jewelers who shine and help them bring in their things that they need to maintain their lives and help them to live properly, and without them it's really sort of detrimental to our company. The RNs, the LVNs, the therapy specialists, the direct care professionals, and case managers all help in getting the issues and staffing to maintaining the clients' livelihoods. There has been an issue with staffing shortages pre-COVID that is due to below livable wages that facilities are able to offer these employees. As it is, our current staff work double shifts to keep the group homes covered at all hours. They deserve to know that they are appreciated for their work and determination to keep the clients in a happy, healthy, and safe environment. We can tell them we appreciate them, but they need their living wages. It's very difficult for them to be able to live and help these clients themselves, but they have their families of their own. As a billing specialist, I have even worked at shifts at our facilities. When they are in a pinch, they call me to work shifts they weren't able to find a DCP for. I am well aware of the need for filling these vacancies and how the staff need to be paid a livable wage to keep them working in their current positions and to recruit new staff. Texas has the largest waiting list for home and community-based services in the country for individuals with intellectual and/or developmental disabilities. Since 2020, the total number of individuals on that list has increased exponentially by over 100,000 people. An influx of people with disabilities were put on the waiting list after many large institutions were closed in the 1990s and early 2000s. Many facilities have had to close on their own due to insufficient funds to maintain their staff members and/or facility costs. Anyone choosing to work as a direct care professional, case manager, or nurses have had to deal with below livable wages because of the HCS program is lacking funds to take a better financial care of their dedicated employees. Direct care staff members have been struggling to survive on the wages the state provides since before the pandemic, yet they continue to provide needed daily support for our clients. Insufficient funding has resulted in some vacancies in the HCS program, and if it continues, there will be no providers left. At Mary Lee Foundation, we currently have 70 HCS clients. Our community first choice clients who live either on their own or with family are the model for individuals to attain. Our clients dream of getting to the point where they can live on their own with specific support from attendants that come to assist them, and these are the goals we work towards. Individuals with IDD want the same opportunities to maintain a quality of life that is afforded to other Americans. In order for the individuals to maintain a certain quality of life that is afforded to all Americans, they need to have caring and dedicated staff such as DCP, case managers, therapists, and nurses to help them thrive in the least restrictive environment for their needs. Without these dedicated workers, this is not possible. Lacking the support from direct care staff members, it proves to be a bigger challenge for some of these individuals to achieve the life that they often dream of attaining in their lifetime. Without the supportive services provided by a fully staffed HCS program, many of the individuals we serve would end up on the street as part of the ever-growing homeless population. I would hate to see that because they are very nice people, and I really appreciate working with them and having the opportunity to get to know all of them. Thank you for letting me speak.
Good afternoon. My name is Carol Smith. Hello. And I'm the Executive Director of the Private Providers Association of Texas, representing, obviously, private providers who across the state provide Medicaid-funded community-based services to people with intellectual and developmental disabilities through the ICF program, Intermediate Care Facility, and the Home and Community-Based Services and Texas Home Living Waiver Program. Is there an echo or something? No? Okay. Sorry. I am going to keep this short. You all have been here a long time, and I really appreciate the way you have attended and kept your attention span. So my comments will focus on the exceptional item request number 24 with regard to community attendant direct care wage increases, which you all have already heard some testimony today. The commission notes in that particular item that even though there was an increase that was funded last session, that providers continue to report challenges in retaining and recruiting staff. And I will tell you, that is an understatement. I've been doing this 49 years. Started out at Legacy TDMHMR, working as direct care at what was back then called Austin State School. And I can assure you, never have I seen a situation like it is today with providers not being able to hire or retain staff, owners having to work shifts, many staff working 60, 70 hours a week, and providers reporting anywhere between 33 and 34% staff vacancy rates. So it is a dire situation out there. And we would certainly ask, and as you had heard earlier today, I think Aaron Lawler mentioned it, that the recent report that the commission issued on their workforce report, that the $17 plus an hour that was given to help with their recruitment and retention significantly helped. We would ask the same. As Ms. Lawler indicated, individuals working in the community providing services to people with intellectual and developmental disabilities are providing the exact same service. The qualifications are the same, and it says they're doing it in the community. And in order to ensure the health and safety and quality and continuity of care, we ask that as session goes forward, as you all deliberate what some of the things that go into the budget, we would ask that you would support parity. I'd like to just mention one more thing. I noticed in the legislative appropriations request, the commission recommended deletion of Rider 4, the cost comparison report. And I would just ask consideration that that report be kept. It has a lot of valuable data in it that would be very hard to obtain, get otherwise with regard to the costs, the individuals being served, their level of need, et cetera, and where they're being served if that report was eliminated. So thank you very much.
Ready? Okay. Good afternoon. I'm Sandy Batten with Providers Alliance for Community Services of Texas, or PACS-TEX. PACS-TEX, like PPAT, represents providers who support people with intellectual and developmental disabilities, or IDD, conditions such as Down syndrome and autism through the Home and Community-Based Services, or HCS waiver program, and in intermediate care facilities, or ICFs. For the past 20-plus years, Texas has prioritized diversion and transition options for individuals with IDD, ensuring those in state-supported living centers and other institutions have the choice to live in the community close to family and friends. The vast majority of individuals with IDD in those circumstances choose an HCS group home or an intermediate care facility. But as you've heard, this system of care is in crisis. The only funding we need is funding to keep the system from breaking more. While we appreciate HHSC's placeholder request for community attendance services and the legislative appropriations request, exceptional item number 24, we believe IDD services are in that request. Addressing the problems, particularly in group homes, requires a comprehensive approach, including flexible funding to address the workforce crisis crippling the system. As you've heard earlier, and as Carol just mentioned, HHSC has demonstrated that increasing the range of starting wages combined with across-the-board raises for all staff have successfully reduced turnover and vacancies in SSLCs. A similar approach is needed for community IDD service, critical shortage areas, DSPs, and nurses. IDD providers face staffing shortages that have the human element of diminishing quality of care and separating families as group homes close. Some of the individuals living in group homes have been there since the 80s, so these are not short-term arrangements, and it's very disruptive when somebody's forced to move. These shortages also have a logistical impact as providers rely on overtime, and administrative and quality assurance staff are forced to cover shifts. The result has also been an increase in regulatory penalties when something goes wrong and financial recoupments. Providers can be recouped the entire daily rate if a staff person works too many hours or documentation is insufficient. And that's much easier to have happen when shorthanded or when staff that check those documents are working shifts. This situation is unsustainable. Providers across the state, including those who began serving the IDD population to support their own children, say they can no longer keep up. One PACS-TEX provider left the state this year, and many others feel like their businesses are on the verge of collapse. While we appreciate HHSC's placeholder, IDD services need to be stabilized by parity with state investment and the SSLC workforce, which is roughly $300 million general revenue for the biennium, according to the Texas Conservative Coalition Research Institute's recent white paper on the IDD workforce crisis. Thank you for your time and consideration of these urgent issues.